Welcome to the Beverly Hills Plastic Surgery Podcast. This is Dr. J. Calvert and Dr. Millicent Rovelo coming to you with a New Year's episode.
Happy New Year!
Happy New Year, Dr. Rovelo.
Happy 2024.
I know, it's a big deal.
By the way, where did 2023 go? Can we ask somebody because no one seems to know?
I mean, it's blowing by.
Whew.
It's an issue.
Yeah.
I know, the older you get, the faster they go, and I am definitely a guy who can attest to that.
Yes, 2023 was great, but we are now looking on to 2024. And, we get it. New year, new you. We do that all the time ad nauseum. But there's something to it, right?
There is. I mean, there's that sort of a reset button that you selectively can use it, right? You don't have to reset everything, but there are things you want to reset. You can press that reset button.
Yes. And, plastic surgery lends itself to that reset very well. We can fit into that New Year's resolution to-do list quite nicely. But as we've done on previous podcasts, we're going to do a little refresher here. You got to have a plan. You got to approach each year with a plastic surgery plan. I know I do. I'm like, what am I doing this year?
You definitely do. and those plans are enacted and they are stuck to, and you make them happen in a very, very regimented way.
I don't do it every year, people. Lay off.
No, but you are definitely militaristic about it. And this year, we're going to do it. Which I love. It's great.
You got to have a plan.
I oftentimes find out what part of that plan I'll be playing in this part of the year. It's like, okay, this is what we're going to do. This year you're going to do this and this and this. And for me. I'm like, oh, did we? No, that's what's happening.
That's when it works for me, so thank you.
Yeah, I'll see you then. Great. I've already put myself on the schedule, and that's that, which is great. I'm happy to be part of your plastic surgery plan. I am going to be on your plastic surgery plan very soon. I need a lot. It may be too late. Maybe it's just time to put me out to pasture, and that's that. But I need some stuff. It's time. First of all, what we're gonna do today is we're gonna help our listeners generate that plastic surgery plan. Generate that plastic surgery plan for themselves. That's easy for me to say, because there's a lot to it. It's actually not simple. And a lot of people we've done this red carpet ready kind of episode. We've done the what's with the Botox. We've done the have a plan episode. How you generate sort of your own aesthetic plan for the year or for your life is not trivial. It's actually pretty complicated. Yeah,
you kind of, for the best results and for optimal results, yes, having a plan is super important. And so let's kind of just start from the obvious, the thing that probably everybody has on their New Year's resolution. I want to lose weight, or this is the year I'm going to get in shape, right?
100%. Great. It is the most common New Year's resolution.
Common one, guilty. Yes. So that's great. Then you have to think about, so maybe your body is what you want to work on this year. And you know that at some point in this year, you may need a tummy tuck. Maybe you're done having kids. Maybe this is the year you're going to get your mommy makeover.
I'm done having kids.
Oh, okay.
Should I get a tummy tuck?
Daddy do-over? Absolutely.
Definitely.
So this is maybe the year you're thinking about doing those body contouring procedures. So what do you need to do to get ready for that? Number one, make sure you're done having kids. That would be helpful. Number two, get to your goal weight. That is most important. And be realistic about what that goal weight is. Yeah. If you can say, I want to lose 50 pounds, but in reality, it's only going to be 10 or 15. That's fine. But go with that. Go with that. Go meet with your chosen plastic surgeon, or maybe this is the time to go see a few, hone down on one, and talk about that plan with them. Because they might say, you do need to lose those 50 pounds before I can, properly do a tummy tuck on you. Or they can just be like, you know what, I can do your tummy tuck now. You're at a totally appropriate weight. If you want to lose more weight, that's on you. And you can if you want, but you don't need to. So then that's when you can really start to make a plan on how much weight you want to lose. Because ideally, you'd be at your goal weight before doing any body contouring procedure. And this includes liposuction too, because liposuction should really be for those hard to hit areas that you can't get with a reasonable diet and exercise plan. So get to where you want to be, get to that healthy goal weight and a healthy fitness and diet program. And then whatever's left behind that you don't like, that's where plastic surgery can come in and really clean up those other areas.
Yeah, I mean, that, and by the way, the weight thing is often, I get asked about that all the time about facelifts, like, oh, should I lose some weight before this facelift? And yeah, if you're 100 pounds overweight and you're planning on having gastric bypass, it's one thing. But if you're going to stay your weight, it doesn't really make too much difference. Your skin will be a little more loose if you lose 10 pounds or 15 pounds or whatever, but it's not relevant because a facelift is like a facial rearrangement that's going to make the difference for you no matter what weight you're at.
Not the, couple centimeters of skin that are removed.
No.
A little bit different with the body. That's why we do say goal weight.
Yes.
Because if you do go on to lose, 15 plus pounds, you are going to see some loose skin. And so you may, want to revise or do more skin removal. So that's why goal weight, because then whatever result you get afterwards will be maintained.
Yeah, and I think the planning for the year, should I always say start with like the stuff that matters, and like your face matters. You're going to want to do some skin care. You're going to want to possibly do some laser resurfacing, possibly some microneedling and PRP. Like there's a lot that you can plan out, but you do have to have that plan for the year. You don't want to just kind of, wait for it to come at you, or as one of my patients, like wait till somebody says something about it and then be like, I need to do this. I keep hearing like, I look like a paper bag. Like, okay, yes, you have some sun damage. Let's get to work on it. So I think that if you know that aesthetics are important to you, which what I find is aesthetics are important to everybody. I don't care who you are. People get up in the morning, they take a shower or whatever, they do their hair, they put on makeup, they look at themselves in the mirror because they're worried about how they look to others and to themselves. They want to have the confidence, they want to look good. And so aesthetics are important. And this concept of just like willy-nilly, I think I'll go do this, I think I'll go do that, is really like a misguided approach to aesthetics. And we've talked about it before. Having a plan makes your life a lot easier in terms of how you're going to spend your money so you don't waste it, because this stuff's expensive. I mean, I can tell you the machines that we buy to do the minimally invasive stuff and our OR time, it all costs a ton of money just to do it. Never mind like you and I trying to make a living doing it, which we do, but the cost of getting these things done is not cheap. And it has to be budgeted. It has to be part of your thought process, and approaching it in a organized and efficient, effective fashion will make a big difference to A, the results you get, and B, how you feel about the results, and C, how much money you spend doing it.
1,000%. And to go back and rehash the face, if you have any kind of skin issues, ideally, you would address them before the facelift. You can always address them after. But to really get that wow factor of the facelift, if you can address the skin issues first, you'll really get that wow factor after. Because if you can get rid of the dark spots or some coarseness or some skin quality issues before your facelift, then you go and you have the facelift. It's just like, and it's like beautiful and it's great. If you don't and you still have a lot of sun damage or the skin is coarse, you can have your facelift and you'll get a good facelift result, but the result will be like,
the chorus of angels got a little weaker on that one. I noticed that.
Yeah.
Yeah. I mean, it is true. You do want to, like, if you can think about it in that way, yeah, you should be taking care of your skin the whole time, especially the Southern Californian, sun damage issue is so real. I mean, you just have to live here and you get sun damage. It's not like,
no,
you don't have to try.
I live in a tent.
No, I know you do. You're like
a beekeeper at all times.
Totally. I mean, you get it, but most people don't. And especially when they were kids, they didn't.
Right.
Especially those of us in the facelift range, like myself. Those of us who are children of the like late 60s and 70s who are now in the 50s getting facelifts, We fried ourselves. We did.
What was sunscreen? Like,
That was sunscreen.
Yeah.
You mean baby oil?
Exactly.
That was sort of the goal. I remember, in high school, we would like go out in the sun and just bake and try to get dark, which for me was absolutely a futile effort. All I could do was turn into a lobster, and I got very red. The red was good, but I couldn't get any color. But
the damage.
The damage was there.
The damage still happens.
And do you get basal cell that way? Sure. I mean, I just took a lesion off one of my patients who's in her 30s, and she's like, I don't know, there's a skin tag on my back. Da-da-da. Turned out to be a basal cell.
Happens.
Yeah, I mean, like we were just like, holy cow.
Put that on your list. Skin checks.
Yeah, do your skin checks.
That should be on your New Year's checklist. You got to get those every year because they are important. If you catch them early, not a big deal. They can be easily treated. But if they persist, then they are problems. So yes, that should be on your New Year's resolution, skin checks.
Especially our Australians, where there's the highest incidence of melanoma in per capita. I mean, they get toasted down under.
Yeah, they sure do.
In a big way. Every plastic surgeon in Australia that I know deals with melanoma like on an abnormally frequent basis. So for all you Aussies,
get your
skin checks. But also, that's part of your plan for your aesthetic, your aesthetic year.
Right.
What am I going to do? Am I going to get Morpheus this year? Am I going to tighten up my skin? Am I going to get some PRP? Am I going to get some microneedling? Go to your practitioner, come into the Rock Spa, talk to Orla, come in and see your plastic surgeon, talk to Dr. Rovelo, come see me, get your plan together, and then make it make sense for you because it has to be customized to like what you do for a living, how much time you have to take off, do you have the downtime? All these things have different aspects to them that it's impossible to know as somebody who's like, I think I'll do some aesthetic surgery and procedures this year. You won't know what we know. We do this all the time, and we can plan it with you, and it does make a huge. It just
makes a huge difference.
You go get your annual physicals. You go to your dentist. Well, guess what? You need a plastic surgeon.
Annual visit with your plastic surgeon.
If you want to look great.
Oh, for sure. If you want to look great.
Pick a good one. You pick the wrong one, you'll wind up looking like a praying mantis, and that's not a cute look.
Well, unless you want to look like one.
Some people do want to look like the mantis lift is real. It's out there. The alien lift. I've seen some stuff lately that just makes me go. Okay.
So yes, choose the surgery that you want, whether it's the breast or the tummy or the face or the nose, and then plan it. So the other thing that you have to really take into consideration is the timing of it and your work and your family responsibilities and vacation plans. So I have a lot of teachers, I have a lot of students, and ideally for them, they would have their surgeries in their downtime. So summertime, Christmas break, spring break. Well, guess what? Those time slots fill up really fast. Spring break, I have like nothing left. Like spring break is a big one, especially for the kids and the teachers. Same thing for summertime and for Christmas break. So if you at all are seriously considering having a plastic surgery and you know you need to fit it into one of those times, come in sooner rather than later, because then you can lock in that time slot that you may really need. The other thing is
definitely
kind of figuring out your recovery time. So a lot of these big body cases that I do need substantial recovery time or time off from work. So if you need to work X amount of days to get enough PTO or something like that for your job, like these are things you have to consider. So go talk to your surgeon, find out how much time do I need off, what's my recovery look like, and when can I do this at a time that makes sense for me.
Yeah, I mean those are all really important kind of aspects of getting this stuff done right. And being proactive about it is key. Maybe this isn't the year, and this is the year you're going to get a little Botox here and there. You're going to do
maybe this is the year you save money. Maybe this is the year you get a price quote and say, I need to save some more pennies, and this is the year you budget. Totally great idea. Like these, it's just we've said this to each other before. Plastic surgery is like buying a car, right? It's an investment.
Yep.
And so you got to plan for it. You have to budget it. It's not the same thing as getting your hair and nails done. Like it is an investment, and you have to take it seriously to that same extent.
Yeah, this stuff is not cheap, and it's getting more expensive. And how to pay for it. In fact, the financing of plastic surgery is onerous with these interest rates. And so that's the other part of it, is that a lot of people aren't going to go to their in the last 7 or 8 years before these interest rate hikes. People would go to their, home equity line of credit, their HELOC loan. They would say, well, take some money out of my house or whatever and do it that way. Or they'd say, I'll get a credit card with a low interest rate. And they'd do that. Now it's like, and your interest rate is 28%. It's
I know.
like, and your $10,000, operation now becomes $18,000 over 3 years. And it's like, no, I'm not doing that. Your $25,000 operation now becomes, $38,000. Like, it's crazy town with the interest rates, and that makes it a bit harder. So you do have to kind of figure out how you're going to do that. And like all the plastic surgeons, including us, we have options for those finance things, but that needs to be a consideration. The money is real. I'm not going to sit here, like if my daughters came to me and said this is the year for our whatever nose jobs or whatever they were doing, I got to put that together, because they ain't cheap, number one, and number two, we're all like kind of living a certain way on the money that we have, make, save, etc. So it is a consideration in how you get this done.
Yep. It is not something, I mean, there are very few people in this world that can say money is of no object. You gotta plan.
It's true. Yeah. I mean, we bump into some of them, but even those folks, they're always conscientious of the cost. I mean, you should be. It's not, I think only, people who don't know any better like throw money away. They're just, it doesn't make sense. Anybody who's had to earn their money is going to be careful about it, especially when they're considering an investment like in a facelift or a big mommy makeover. These things are big operations. They take a lot of time. They have to take time off from work to do it. So you're not earning when you're doing it. There's all of that has to go into your planning for the new year.
And that's it. I mean, that is the message. Plan these things. So go make that appointment with your friendly neighborhood plastic surgeon. Come up with a plan. Maybe this isn't the year. Maybe you do some non-invasive things. Maybe you budget for next year, but have a plan.
I've been thinking about something for my year, actually.
What's that?
Butt implants. I think that's really what I need. I think that's where I'm going to go. I think what I really need for me is a bigger butt. No?
Sure. Why not? Why not?
Actually, I'm actually okay in that department. But the reality is that whatever it is, go do it and figure it out. I do have a lot of people that are thinking about BBLs, but the people that I talk to about BBLs, I have to do the skinny BBL. So
Yeah, because your patients have no fat.
I don't. I have the like. Why do the thinnest patients I have are they're always like, what I really want is I want to get a BBL. I was like, with what fat?
Right.
Go eat like 48 hamburgers and come back cheeseburgers and talk to me afterwards. And by the way, eat some ice cream sundaes on the way, because that makes it very hard to do a BBL.
Very hard. So yes, if you don't have the fat, it cannot be done.
No. So that's a message to my patients. If you're thinking that way,
eat up.
Eat up. Enjoy the New Year's celebrations.
You'll have a different New Year's resolution.
That's right. Yeah. I need to get fat. That's usually not the usual. Anything else about our planning?
Nope. I think that's it. Just be cognizant that you need a plan, and we are here to help you make that.
Sure. We're always around. You guys can always check out our Instagram, DM us. We've got our own accounts around. There's always a way to kind of get some information. We're happy to help. And this is the Beverly Hills Plastic Surgery Podcast, coming to you from the 90210 with a very happy and healthy new year for everyone.